Canada does not seem to have such an enterprise. These US companies' reach extends beyond North America, beyond Europe, beyond into almost every country. Those who purchase their services sign waivers that provide consent to a clear set of terms and agreements, but it makes it very clear that they don't practice medicine. Canada's landscape is different. We do not have such an enterprise. Our research and genetic testings tend to be carried out in hospital and laboratory settings, research institutes, and genomic centers across the country. To date, our 6 Canadian genomic centers have led over $1.6 billion in genomics research, and we do hope that that will continue. Indeed, we have an attractive and fertile environment for research. The Research Institute of the McGill University Health Center and McGill University can offer up many proof points. Our homegrown world firsts in the field of genomics alone have identified genes in diabetes, tuberculosis, ALS, several types of cancers, and epilepsy, among other diseases and conditions. Each year, we gain new knowledge, which brings me, in a way, to the crux of this discussion. People's access to information is borderless. We don't have to live in the United States to be attracted by the idea of acquiring our own or others' genetic information. When MRIs became available, Canadians wanted access. When PET-CT scans became available, Canadians wanted access. It did not matter, to some extent, that these tests may be somewhat contraindicated or indicated for their diagnosis or treatment. Cost and utility issues aside, let's remember that we're in a new world, a digital era, an informed consumerate, and that is getting increasingly transparent. Whether it's an X-ray, a person's family history, or his genetic risks for developing one or more diseases, we're on the cusp of putting it all in an electronic medical record. What kind of provisions are we making for protecting ourselves against widespread electronic access to our information? Can insurance companies gain access to this information and deny coverage? Can, say, an adoption agency acquire the information and limit people's right to adopt? How do we share this information? Namely, how do we ensure that people understand the ramifications and the limitations of the information that's provided? So let us have a little look at some of our laws. How does it fit into this picture? In essence, with respect to genomics, it can be said that perhaps the law is lagging a little bit behind the science. In May of 2008, the United States enacted GINA, Genetic Information Non-Discrimination Act. The act which tries to limit the possibility of using genetic information in a discriminatory manner vis-a-vis insurance and employment. In Canada, however, no province has enacted a specific anti-genetic discrimination law. Because of our publicly funded healthcare system, there is less concern about the impact of genetic testing on healthcare insurance and on access to healthcare as it would be in the United States. Nevertheless, many policy-making entities have recommended some form of policy reforms, including limiting the use of genetic information in the context of insurance and employment, strengthening privacy laws, and mandating an entitlement to a minimum amount of life, disability, and health insurance. You know, some would in fact even argue a concern that in the Quebec Charter of Human Rights and Freedoms, there apparently appears to be something that actually permits just the opposite. That the use of health, which can be determined from genetic testing, is a predetermination of risk, is not necessarily considered discriminatory. For example, if you look at the Charter of Rights and Freedoms, Article 20.1, it does state that if an insurance or pension contract, a social benefits plan, a retirement pension or insurance plan, or a public pension or pension insurance plan, a distinction, exclusion, or preference based on age, sex, or civil status is deemed non-discriminatory. where the use thereof is warranted and the base is an at-risk determination factor based on actuarial data. It's a bit wordy, isn't it? In such contracts or plans, the use of health as a risk determination factor does not constitute discrimination. As such, there is therefore a concern that insurance companies could be authorized to regard participation in research and individual research outcomes as risk determination factors. Now, this concern, in fact, is well-founded. For example, if you look at the 1992 Zurich Insurance Supreme Court decision, a decision which was eloquently summed up by two Lemons, University of Toronto Faculty of Law, which in fact was published in the McGill Law Review, entitled Selective Justice, Genetic Discrimination, and Insurance, and Should We Single Out Genes in Our Laws? He wrote, if we are to follow the line of reasoning of the court, insurers may use genetic information and discriminate against people with genetic susceptibilities in underwriting, if they can demonstrate that such discrimination is based on a sound and accepted insurance practice that aims at achieving the business objective of charging premiums that are commensurate with risk. If they're able to support their practice for statistical and actuarial tables and can show that there is no practical alternative, insurers will be able to use genetic information in the underwriting process. Since most genetic tests aim at indicating a specific risk factor based on statistical calculations, it would not be difficult for insurance companies to justify the use of genetic information and or genetic testing. Insurers could argue that they have no practical alternative but to obtain the same level of accurate information as may be obtained through genetic testing. As mentioned earlier, insurance is based on a full disclosure of the risk. Insurers would argue that they must be able to use this form of testing to obtain information that applicants would otherwise try to hide. Similar but not unrelated concerns on the use of genetic testing results by governments also formed part of the 1995 report of the Privacy Commissioner of Canada, entitled Genetic Testing and Privacy. The report stated that the Charter of Rights adds another dimension to the Privacy Act protection against governmental intrusions, that federal legislation that permits collecting, using, or disclosing personal information could override the Privacy Act. However, it might still violate Charter right protections. For example, a law might seek to permit government to collect, to use, or disclose personal information in a way that violates the Charter protection against unreasonable right or seizure, or that violates the right to life, liberty, and the security of the person. But if the law violation of the Charter is challenged, it is likely that the court will hold the law void.